Okay. Welcome, everyone. Thank you for joining us today. For those of you who possibly have not met me, I think there are a few people on here I have not met. I'm Norma Loeb. I'm founder of the Lewy Body Dementia Resource Center. I founded the organization 8 years ago after my mom passed, and she had Lewy body for a very long time, actually 18 years, which, as you all know, is not the norm. And we now have the only live helpline in the country for Lewy body, so please never hesitate to call. We're here 365 days a year. And I think you all have the number, and we have the website, and we have support groups. So please don't hesitate to call or email if you need any help at all. So today I'm really, really happy that Lara Scher has agreed to do this wonderful webinar for all of us. And let me just give you background on Lara. She's a certified speech language pathologist. And for those who don't know, because I wasn't sure, a speech pathologist and a speech therapist can be used interchangeable. It's the same thing. She is a teacher of speech and the hearing handicapped for both adult and pediatric populations. She's been in private practice for 16 years. She's also a professor and clinical supervisor at Adelphi University and a professor at St. John's University. So, Lara, I thank you for being here, and I turn it over to you.
Okay. Well, thank you. And it's nice to see all of you joining. I thank you for my introduction. I also am the daughter of a parent with Lewy body dementia and the daughter of a parent who is the caregiver of Lewy body dementia. And just going forward, to abbreviate, we'll use LBD. And in terms of speech language pathologist, if it's okay, if we could say SLP, it's just less of a mouthful to get through, okay? So what's our goal here? What's the goal of this presentation? Well, we all have to live with certain conditions throughout our life, and part of the goal of receiving speech and language therapy is to improve confidence, self-esteem, to continue socializing, to interact, because just because we have a diagnosis doesn't mean that's it. Okay, it's important to keep living and functioning and engaging in activities of daily living, which are called ADLs, activities of daily living. So to start, I always begin my courses with a few concepts that I think are relevant for today. And the first one is called person first language. Person first language. This means that we see the person and not the disease. Okay? You are not LBD. You are not Alzheimer's. You are not, God forbid, cancer, okay? You are a person with this condition. And this is really important to change your mindset, because this is not your identity. So if you think about that for a moment, you know, like I said, we all have things that we have to live with, different severities, different degrees, but we have to remember who we are as people before a diagnosis or a disease or disorder. It's also interesting that 1 in 4 individuals have a disability. That's a really high percentage if you think about it. Some of them are invisible and some of them are visible. So what does that mean? That means when you're in a group of 4, we all are living with something. Visible disability may include a physical disability, a visual impairment, something we see. But like Lewy body dementia or any cognitive disability or disease, that's invisible. For example, ADHD is invisible. Autism is invisible. So what does that mean for us? That means we have to educate others when we go out into the community and say, you know what? You may not know that I'm struggling communicatively or cognitively, but I am. And this increases people's awareness and allows you to have freedom to function in society. So for example, my son has ADHD. I don't call him the ADHD child. I say he is a child with ADHD, okay? My dad has Lewy body dementia. That's not who he is.
Yeah.
That's not who he is. He's a father, a husband. He was a principal. That's who he is. And he's living with Lewy body dementia. Okay. Comorbidities is another term I'd like to touch upon. We need to advocate for ourselves, and when we go to doctor appointments, healthcare appointments, we need to say, I have other conditions going on. If you are hard of hearing, if you have a visual impairment, for example, we must educate our doctors and providers because this will make communicating more difficult, okay? I know from my dad personally, he is hard of hearing. So in addition to confusion and cognitive difficulties, it's even harder to go out to a restaurant that has a noisy background. So we need to think about these external factors that can negatively impact cognition and communication, okay? And the last term I want to introduce to you is something called ableism. Ableism. This concept reinforces that we still have abilities. Okay, ableism. We focus on your identity, we focus on the person, and we focus on what we are still able to do. Now, I know, like with any disease or disorder, it can be challenging and our bodies are not working in which they were. I understand that, but you still have abilities. You still do have abilities. And so I guess the purpose of today is for you to focus on who you are, because you are still that person, and your abilities. Okay, so that's first and foremost, and I think most important of this presentation. Does anybody have any questions so far? Okay, so like I said before, the goal of speech language pathology is to improve the quality of life. That's our goal, whether it's for a child or an adult. We like to help individuals, we try to help individuals engage in ADLs, which are activities of daily living, by using functional communication skills. What are ADLs? Food shopping, going to the bank, going out to a restaurant, family gatherings and holidays, maybe attending a show. Okay, these are examples of ADLs. It's important that we continue to engage in activities of daily living. Another goal is to improve conversational skills with a partner, with a family member, and with a friend. Speech language pathologists try to decrease level of frustration or even feelings of possible embarrassment, decrease anxiety, and overall increase level of confidence. So what's the purpose of receiving speech and language therapy? Well, it's to improve the ability to express your ideas and your thoughts, your feelings, help with speaking and reading and writing, to interpret nonverbal communication, and really just to get your point across. I understand that verbal communication may become more difficult, and we use supplemental compensatory strategies to aid in communication. So, for example, I'm skipping around a little bit, but for example, we will practice by role-playing situations. When we go out to dinner and we're ordering from the waiter or the waitress, what do we say? What do we, how do we clarify our message? How do we request what we want? We rehearse. We practice by rehearsing, writing scripts that are in front of you. So it gives you greater control, greater confidence to communicate, okay? Making doctor appointments, ordering food, refilling a prescription, picking up a prescription. These are all parts of our everyday life and our activities of daily living. We help caregivers aid in the communication process by saying, please try to use more concise language to get the point across. Ask yes or no questions. Provide choices if that's helpful. Repeat yourself if necessary. Validate. I know what you are trying to say. I know you know. I understand you're struggling. Educate others. Educate others. It's important to educate others. Like I said, this is an invisible disease. This is invisible. You're not walking around, you're not in a wheel. Well, I'm not sure. You, as of I see right now, you're not physically disabled. Maybe you are. I'm not aware. But you know, even I
don't think this is.
am struggling with my vision lately, and I have to say, I'm sorry, I can't see it. Okay, that's a simple example. It's okay for you to say, you know what, I have dementia, and I'm having a hard time understanding what it is you're asking of me. Okay, or I'm having a hard time expressing myself. That's okay. That's okay. And it's actually beneficial to teach others around you. So some of the things we work on, actually, it's quite a large field, and I'll just touch upon pieces of what speech language pathologists address with an individual with dementia. We work on understanding directions, answering questions, maybe understanding a message if the phone rings and you're taking a message. Okay, we practice that, we role play. We work on expression of finding the right word or retrieving a word, possibly increasing your length or your utterances. If you've been using maybe just one or two words, well, let's try to use a larger utterance, a sentence. A big part of dementia and many cognitive disorders include something called paraphasias. And there are all different kinds of paraphasias, but for example, one might say a word that is related to the word you want to say. So if I'm talking, I might say, my sister went to the wedding, but I'm trying to say my cousin went to the wedding. So this is called a semantic paraphasia, in which the word is related but it's not correct. This is a common symptom or expressive language difficulty that many people experience. You might say month for year. So it's a substitution. It's not the correct word, but it might be related, okay? What happens when this occurs? There's a breakdown in communication. There's a breakdown in meeting, and conversations become difficult for the caregiver as well as for you. Recently, I was at a friend's house who does not have a diagnosis of dementia. And she was trying to explain to me, she was trying to find the word spectrum. And she kept saying the word rainbow. And I could not understand what she said. I couldn't understand the meaning. And then she said, you know, the rainbow. And she went like this. And what did she do? She added a gesture. And guess what? I understood what she was trying to say. She was trying to use the word spectrum. So sometimes when we use gestures to get our point across, that's extremely helpful, whether it's to point to something, to act it out, to describe a word. Gestures are extremely, extremely important. Nonverbal communication is extremely important in conveying our messages. We address reasoning skills, which may be affected, problem-solving skills. Another area we address are social language skills called pragmatic language skills. And this is really what my purpose is for today, for you. It's hard to function when we're struggling, but to be withdrawn doesn't help a situation. It doesn't help. It's important to be stimulated. Go out in the community, go out with friends, engage in conversation with others. It's really important emotionally as well as for language stimulation. Last part of what speech language pathologists or SLPs do has to do with speech in relation to voice. Sometimes people with dementia will become dysarthric. This is a speech disorder in which the articulators, which are our tongue, our teeth, our jaw, our lips, become weak, okay? Especially with the Parkinson's component of LBD, one may become dysarthric, and the speech may sound a little bit slurred. We say imprecise. So we do address this. We work on dysarthric speech to increase clarity of speech. We also work on voice. Sometimes our voice becomes weak as well. Our vocal cords, which produces voice, it's muscles as well. They become weak. So we work on increasing volume or loudness and voice. And then more importantly, if we are noticing that a patient is dysarthric, is having difficulties with their voice, if it sounds wet, there's a wet sound to their voice, a gurgliness on their vocal cords, we then become concerned that this may lead to swallowing problems. So if you are experiencing any of these wetness or maybe increased coughing, for example, you may want to consider seeing an ear, nose, and throat specialist or a speech language pathologist to determine that your vocal cords are functioning intactly. There are tests that we do in order to assess your swallowing function in a hospital or an ear, nose, and throat specialist office. Part of what we do is discuss diet as well. If you're having issues with your vocal cords, we try to educate you on possibly decreasing foods or liquids that may cause reflux. Because when we have reflux, our vocal cords, the muscles used for speaking, become inflamed and swollen. And this causes additional difficulty with speech and swallowing. We may tell you to rest your voice, not to scream or yell, not to whisper. Recently, I noticed that my own dad had a little bit of wet sounding voice, and I became concerned. So I recommended that he start using a device that I'll share with you in a moment. I have a picture of it. It's called an EMST, which stands for Expiratory Muscle Strength Training, EMST. And what it does is we speak on exhalation. So when we inhale, we breathe. And when we exhale, that's how we speak. What this device does is it strengthens the musculature for breathing, for respiration, as well as the vocal cords for speaking and for swallowing. If anyone is noticing problems with their voice, you can certainly ask me after this talk, or I can certainly help you find a doctor. It's also helpful to always be aware of distractions when we're out and about in the community. Okay, so if you do have visual impairments or hard of hearing, for example, you would want a bright place, not dim. You would want a place that has reduced background noise. You always want to be face to face with your conversational partner so they could see you. And it's always important to use your personal assistive technology, which might be hearing aids or glasses, okay? Some strategies we might also teach our patients and their families may include bring a pen and paper out when you go out to dinner, if you lose your train of thought frequently and you want to add something to a conversation, write it down, write down the topic, or write down a note so you can come back to that. You can always draw something to get your message across. It doesn't have to be elaborate. It just has to be a simple picture. Anything that will help you communicate is great. You can use drawing, gesturing, like I said before, writing words. You can bring scripts with you, which gives a little more reassurance and confidence. So you know what to say. You can read it and be a little more confident. And lastly, it's really important that your providers, your healthcare providers, collaborate. This means if you're receiving speech pathology, if you're receiving occupational physical therapy, it's important that there is a team approach and the healthcare providers communicate to be on the same page, the same treatment plan. I also, with my own practice, with my patients in my own practice, always usually begin with mindfulness. This is a new concept that schools are using with children, that healthcare providers are trying to incorporate into treatment. Why is this important? Because it relaxes ourselves, it relaxes our mind, it relaxes our musculature, it increases clarity in our minds. Breathing and being in the moment is really important. Really, really important. I always refer for counseling as well, whether it's a child, whether it's an adult. Counseling and support is essential for therapy and for life functioning, for the caregiver, for the patient, for the sibling. It's really, really important. Always seek therapy, counseling, engage in these amazing support groups. And that, I think that's really it. If anybody has questions, I'm happy to answer.
Lara, thank you so much. That was extremely informative. I have no doubt that some people must have questions. Okay. Somebody's leaving. Somebody have any questions? I know Lara shared a lot and maybe you don't need to know anymore. But
I have one question.
okay, Kathy.
It's my husband who had Lewy body. I now run a support group. And I know that my husband and some others, loved ones of those in my group, really lose their ability to write later in the disease or to read. So then what? Would a recording device do any good?
Yeah, so there is assistive technology. Like I said, with Lewy body dementia and with any disorder for that matter, there's different degrees and different severities. So I'm just generally speaking here. Yes, in that scenario, there are assistive technology devices that may be utilized. Speech language pathologist can help in that area. There's a whole area devoted to that assistive technology. There are patients that have ALS that no longer can, they lose motor control and they lose verbal control and they use visual abilities to express themselves on these devices, which is absolutely incredible. So there are many, many, many devices that may assist in communication.
Thank you, Lara. Can you elaborate on the EMST device that you had?
Oh, yes,
mentioned
yes.
earlier?
I would like to share what it looks like if you're interested. And also, my mom shared, which I forgot to mention, it's always helpful, another strategy to maybe reduce confusion, is scheduling. So day to day, it might be overwhelming for a person with LBD to know what to expect, what's happening that day, what's happening that week. And if it's concrete, if it's on a board, a visual board, for example, that might be helpful. And again, I will show you a picture right now, but this is a board that shows the week's activities. Again, depending on the severity of the individual who has LBD, you might just modify that and do daily. Today, this is today what we're doing, what appointments we have. Okay, so let me share that with you. And I'll share the EMST as well. Norma, would you allow me?
Sure. Sorry.
Thanks.
Okay.
Thank you.
Mhm.
Okay, so here's a picture of the EMST 75. And it's really simple in that you, every day at the same time, breathe into this, and it really strengthens the muscles related to breathing. and the vocal cords related to speaking and swallowing. But however, this is only if you have concerns with your voice and it's deemed necessary. So this is helpful if need be. And this is an example of a visual strategy used to decrease confusion day to day. So this kind of has a lot going on, a lot of stimulation here. So it says Sunday, this was Sunday, Monday's activities, Tuesdays, Wednesday. So again, depending on the person's level of functioning and cognition for that matter, you would modify this board. So it's a little more simple to understand.
Yeah. The EMST machine, Lara, how often is that used in a day?
It's used once a day for about 10 minutes, 10, 15 minutes. It's supposed to be used around the same time every day.
Okay.
And there's a nice video that shows you exactly how to use it on the
Okay.
website. And if anyone needs information on this, you can certainly email me and reach out to me and I will help you obtain that. It's also now covered by insurance, which is nice.
Did you still want this showing on the screen?
Oh,
Yes, King.
oh my gosh.
No, that's okay. I
I'm
just wanted you to
sorry.
know. No, it happens to me all the time. So somebody else put something in chat asking if speech therapy helps with word finding, because
Absolutely.
I know you mentioned that before about gestures and
Absolutely. That's really a big part of what we do is help with word retrieval as well as word finding. And we use strategies also. You know, if you can't find the right word, well, describe it. What does it look like? You know, where do you find it? What do you do with it? What's the function of it? To try to elicit the target word. And if that doesn't work, you know, you can always try to write it if possible, or gesture or point or find a picture of it. So, yeah.
okay. Thank you. Who else has a question while we're on here? Anybody? Yes. Is it Terry? You're on mute. Because is it Terry?
Yes, we never
Ye-
did see the chart.
Oh,
She was talking about,
Oh, I can, do you want me to put it in the chat?
sure, yes.
Okay. I'll write the name in the chat so everyone can see it. It's,
And
there's a longer name, but I'll write the longer name too.
um,
Okay.
you had mentioned it being very important to get your providers to communicate with each other. That's been one of my most difficult things, is getting the providers. I always talk to them up front and they say, oh yeah, we'll do that. And I know my main neurologist reads everything that comes to her, Dr. Holden. She and I communicate really well, but she's constantly having to remind me, you know, I'm still trying to get this information, or I'm still trying to get that information. And then in dealing with disability, I've got one doctor in Dallas. I just moved to Colorado from Texas, and I've got one provider in Texas that said he's sending everything requested, but he hasn't sent anything at all. And I'm ending up having to get all of his records sent to my disability for my current neurologist, because she was able to go online and get all of his records. So how do we rectify that? I don't know ahead of time if a provider is going to provide information, and I can't believe them when they tell me that they will.
yeah,
And I can't even believe them when they tell me that they provided information.
yeah. I
So
understand.
you know, I don't know if the problem is they're doing everything electronically and there's
Yes.
different protocols, and they're getting error messages and they're ignoring them instead of working around it. You know, I don't know what to do. This is the most frustrating part of all this to me.
Yes, I agree. And it's not easy. I'm not going to say it is easy. I struggle with that as well. I think truthfully that providers are overbooked and they don't really have the time anymore to communicate. They don't really allow that in their schedules because they are double booked, triple booked. And so it's our job as the patient to self-advocate. That's our job, and to be on them and constantly email or call. And it's extremely frustrating. I understand that, but it's best to have them communicate. I'm not saying once a week, maybe once every 6 months, just to touch base about your progress, about, where, it's good to get a baseline and have them all be on board, and then your progress every so often, maybe every 6 months. And unfortunately, I don't have an answer for that because I'm struggling as well, but I advocate. I constantly say, please, reach out to the psychologist, please reach out to my ENT. But it's important that you try to make that happen. It really, really is. And, there are facilities, whether it's rehab facilities, outpatient facilities, that there are, it's a there's all different providers that work there. I used to work in one where there's a general doctor, there's a neurologist, there's speech, OT, PT, and we all met probably once a month about a patient to discuss their progress and our treatment, if we should modify it. So I don't know if that's possible. I don't know if you want to start over in a new facility with a whole new group. Yeah.
I want to say thank you for that, Lara. And Terry, the same way that Lara just said too about the frustration, I hear what you said so many times, and from people who don't even have Lewy body. Any medical issue, it's the same frustration, aggravation, not getting answers. And as she just suggested also, it's best if you can be in a group. But I can say I'm talking New York wise, so I know that a little bit better, but I hear it throughout the country. And not only throughout the country, there are somebody on here internationally who knows that there are very few medical centers that have groups. I can name less than a handful that work together really well. So if you can find one, that's the best scenario. But I like to be very positive, but I'm saying it's not easy to find. And that's why, so when you're having that frustration, or if you need any other information other than getting reports, to keep asking. And as Noelle points out, to establish a relationship with the assistant. That's another part. Some of the offices have people who are not the most helpful. Let me say that in the nicest way I can. And then all you need for anything that you do on the airline, anything that you do, you find that one really helpful person. It makes all the difference. So with whatever you do, if I'm calling an airline and I'm getting information that's not making any sense to me, I said, thank you, I hang up.
Right.
And I just call back and get someone else. I know you can't always do that in a doctor's office, but finding the right person to be helpful. And then if we can help in any way, I just, of course, want to say that again. I'm putting this here before I forget. If anyone, I put the helpline and email. If you have any questions, want the recording, I'm happy to send it too. I can't help with the issue that you just said, Terry. Unfortunately, if I could, I would. So I wanted to know if anyone else had questions for Lara while she's here. Anything else? And to know that there are many speech therapists, a lot are covered by Medicare. They are around. I think people just don't know that they're available and extremely helpful.
Yes.
So if nobody else does have questions, and if Lara, if you have anything else that you wanted to add? No.
No, I mean, if you need help finding a speech pathologist, I'm happy to help you. If you're in another state, you can reach out to me. I also treat actually most of my patients on Zoom, which is, it's kind of nice now because in New York, the weather is getting colder, it might snow. As we age, we don't really want to go out as much, or if we have mobility issues. So there are benefits of Zoom. If you would like, I would be happy to work with you. But I can help you find someone if you'd like to go in person closer to where you live. There's a resource center called ASHA. It's ASHA, American Speech Language Hearing Association, ASHA. You can certainly go on their website and type in the state that you live in and find somebody. And I would hope that your neurologist or your primary care physician would have somebody that they refer to, but they may not. They may not. So ASHA is always a good resource.
That's really helpful. And I think I'll share that in one of our newsletters. I'll put that on the website so people know, because I didn't know that. So thank you for that, Lara. And if anybody, I'll just ask one more time if anyone has questions. And if not, I thank you all for attending. I thank Lara Scher so much for joining us, because I know this will be very helpful to everybody who's on here, and for many others who are not on here, who will be still hearing it or seeing more information on the site. So thank you so much for taking the time and for being with us.
Thank you.
Thank you all.
Thank you.
Okay.
Thanks so much.
Bye-bye.
Take care.
Oh,
Thank you.
Thank you.
Welcome,
Thank you.
everyone.